My name is Dr. Shagas. I'm a low vision optometrist at the Lighthouse Low Vision Clinic in Seattle. The low vision clinic focuses more on evaluation of functional vision and what can we do to help. What kind of goals do you have? What is the, if you were to think, day-to-day life, what is the area that you have most difficulty with? And then we figure out, how to approach that and how to meet those goals. So the first step here with this chart in particular is the patient will need to measure the length of this arrow in inches. As you know, when patients call in, they can call from their computer, they can call from a laptop, sometimes they call from an iPad or their smartphone. And so when they measure this length of the arrow, it gives me an idea in terms of the size of the image that comes across when they're looking at the screen. So once I have this measurement, we can get started, measure visual acuity one eye at a time. We also need a measurement from the eyes to the chart. Again, that helps me in terms of calculating magnification that is needed. And then we figure out, where is it that letters become more difficult? Where do I hear that the patient is starting to slow down when they read the letters? And that gives me an idea in terms of functional vision. Usually when you see your eye doctor, they say, read the smallest line that you can see. And that's not the case with functional vision. I want to make sure that I know what is comfortable vision and where is it that, the patient is reading the chart and they're reading it with some fluidity so that, when you're reading a newspaper, gosh, you don't want to read it one letter at a time. And that's what I'm listening for when I'm seeing patients during a visit like this. Once this part of the visit is complete, we also go through and look at a chart called the Amsler Grid. So this is an Amsler Grid, and what it allows for me, it gives me some information in terms of what the patient is seeing and where in the macular has their vision been affected by macular degeneration, for instance. So I have them look right in the center of that grid and describe what they see in terms of the lines going up and down and side to side. Are there any distortions in those lines? If so, where are they? Once we know and we can map out where those are located, we also figure out a way, can we use our peripheral vision to move those areas out of the way to help patients see better when they are doing things like reading, or watching television, or even looking out the window, kind of moving that area out of the way to get a better visual acuity there. So, once that initial visit is complete, we talk about, the different devices that are appropriate to meet those goals. Is it a spectacle wearing magnifier or a handheld or a stand magnifier? Depending on what it is, we actually send those devices to the patient's home. Once we found devices that work well for the patient, they begin the training process with our occupational therapist, Maya. And when we were talking about forming the clinic and what was important, training is really important. Often, patients come in and they say, gosh, look, I got this telescope or this magnifier, and it's just sitting in my drawer because, no one's really taught me how to use it. So it's really important that we figure out what works best and that we do that training portion of it as well to make sure that the patients can incorporate it into their life and use it so it doesn't end up in the drawer.